Rheumatoid arthritis, or RA, is a chronic autoimmune disease. It causes pain, swelling, and stiffness in the joints. Early diagnosis and treatment are crucial. They help manage symptoms and prevent joint damage. Steroids, also known as glucocorticoids, are powerful anti-inflammatory drugs. They can provide rapid relief from RA symptoms. However, early and prolonged use of steroids in RA is a concern. It can lead to dependence and serious side effects. This essay will delve into the implications of early steroid use in RA. We will examine recent research highlighting the link between early steroid initiation and prolonged treatment duration. This essay will also emphasize the importance of timely access to rheumatologists. It will discuss the potential risks of long-term steroid use. Finally, it will underscore the need for better collaboration between primary care physicians and rheumatologists in managing RA. A recent study published investigated the use of steroids in older adults with early RA. The study found that starting steroids before seeing a rheumatologist was associated with longer treatment duration. This suggests that early intervention by rheumatologists might help reduce the need for prolonged steroid use. The study highlights a critical issue in RA management. Many patients are prescribed steroids by their primary care physicians before being referred to a specialist. While this can provide temporary relief, it may inadvertently lead to prolonged steroid exposure. This increases the risk of developing side effects. These findings emphasize the importance of timely referral to a rheumatologist. Early access to specialist care allows for prompt diagnosis and initiation of disease-modifying anti-rheumatic drugs, or DMARDs. DMARDs are the cornerstone of RA treatment. They can slow down disease progression and reduce the need for steroids. Rheumatoid arthritis is a chronic inflammatory disorder. It primarily affects the joints. It is an autoimmune disease. This means the body's immune system mistakenly attacks its tissues. In RA, the immune system targets the lining of the joints, known as the synovium. This causes inflammation, pain, stiffness, and swelling. Over time, chronic inflammation can damage cartilage and bone. This leads to joint deformities and disability. RA can also affect other organs such as the lungs, heart, and eyes. The exact cause of RA is unknown. However, genetic and environmental factors are thought to play a role. Early diagnosis and treatment are essential to manage RA effectively. Treatment typically involves a combination of medication, physical therapy, and lifestyle modifications. The goal is to relieve symptoms, slow disease progression, and improve quality of life. Steroids are potent anti-inflammatory drugs. They can quickly reduce inflammation and alleviate RA symptoms. They work by suppressing the immune system's response. This reduces the production of inflammatory chemicals that cause pain and swelling. Steroids can be administered orally, injected into the joints, or given intravenously. While effective in the short term, long-term steroid use is associated with a range of side effects. These include weight gain, osteoporosis or weakening of the bones, increased risk of infections, and skin thinning. Therefore, steroids are typically used as a bridge therapy. They provide relief until DMARDs take effect. DMARDs work by suppressing the overactive immune response responsible for RA. They help slow down disease progression and prevent joint damage. Unlike steroids, DMARDs do not provide immediate relief. They can take several weeks or months to show their full effect. Section 5. Timely access to rheumatologists, crucial for early RA management. Timely access to rheumatologists is essential for people with suspected or early RA. Rheumatologists are specialists in diagnosing and treating arthritis and other rheumatic diseases. They have the expertise to make an accurate diagnosis. They can initiate appropriate treatment promptly. Early intervention by a rheumatologist is crucial. It ensures that patients receive the most effective treatment at the earliest opportunity. This can significantly improve long-term outcomes and reduce the risk of complications. Delays in diagnosis and treatment can lead to irreversible joint damage and disability. Unfortunately, many patients face significant barriers to accessing rheumatology care. These barriers include a shortage of rheumatologists, long wait times for appointments, and geographical disparities in access to specialists. These challenges highlight the need for systemic changes to improve access to rheumatology services. Section 6. Risks and side effects of long-term steroid use. While steroids can provide significant relief from RA symptoms, long-term use is associated with a wide range of side effects. These side effects can affect various organ systems and can severely impact a person's health and quality of life. One of the most concerning side effects of long-term steroid use is osteoporosis. Steroids interfere with bone metabolism. This leads to decreased bone density and an increased risk of fractures. Steroids can also suppress the immune system. This makes individuals more susceptible to infections. Other side effects include weight gain, increased blood sugar levels, which can lead to type 2 diabetes, high blood pressure, cataracts, thinning of the skin, and mood changes. Long-term steroid use can also lead to adrenal insufficiency. This is a condition where the adrenal glands do not produce enough cortisol. Section 7. The importance of collaboration between primary care and rheumatology. Managing RA effectively requires a multidisciplinary approach involving primary care physicians and rheumatologists. Collaboration between these healthcare professionals is crucial to ensure that patients receive timely and appropriate care. Primary care physicians play a vital role in early identification and referral of patients with suspected RA. Early referral to a rheumatologist allows for prompt diagnosis and initiation of DMARD therapy, which can delay disease progression and reduce the need for long-term steroids. Once a diagnosis of RA is confirmed, primary care physicians can collaborate with rheumatologists to monitor the patient's condition, manage comorbidities, and address any medication side effects. Effective communication between primary care physicians and rheumatologists is essential for seamless patient care. This includes sharing relevant medical information, coordinating treatment plans, and ensuring that patients receive appropriate follow-up care. Collaboration between these healthcare professionals can optimize patient outcomes and improve the management of RA. Section 8. Study implications, improving early rheumatoid arthritis management. The findings of the study on early steroid use in RA have significant implications for clinical practice. The study highlights the need for greater awareness among primary care physicians about the potential risks of prolonged steroid use in RA. It also underscores the importance of early referral to a rheumatologist for patients with suspected or early RA. The study suggests that implementing strategies to improve timely access to rheumatology care could significantly impact the management of RA. This might involve increasing the number of rheumatologists, expanding telehealth services to improve access in rural or underserved areas, and developing clear referral pathways to expedite the referral process. By addressing the delays in accessing specialist care, healthcare systems can ensure that patients with RA receive prompt diagnosis and treatment. This can lead to better disease control, reduced reliance on long-term steroids, and improved long-term outcomes for patients. Section 9. Limitations of the study, a balanced perspective. The study provides valuable insights into the use of steroids in early RA but has limitations. It cannot establish a cause and effect relationship, and other factors might have influenced the results. The study population consisted of older adults, limiting generalizability to younger populations. Further research is needed to see if similar patterns exist in younger age groups. Despite these limitations, the findings raise important questions about managing early RA. Early intervention and minimizing long-term steroid use. Early diagnosis and treatment are key in managing rheumatoid arthritis. Steroids provide rapid relief but have significant long-term side effects. Early referral to a rheumatologist ensures timely DMARD therapy. This can slow disease progression and reduce prolonged steroid use. Collaboration between primary care and rheumatologists is essential. Early identification, shared decision-making, and ongoing monitoring are crucial. Working together optimizes patient outcomes and quality of life. Section 11. A call to action, improving care for rheumatoid arthritis patients. Improving care for rheumatoid arthritis requires a multifaceted approach. Healthcare providers, policymakers, and patient advocacy groups all play a role. Raise awareness among primary care physicians about early referral to rheumatologists. Develop clear referral guidelines and educational programs. Address the shortage of rheumatologists, especially in rural areas. Expand telehealth services to reach remote patients. Empower patients to be active participants in their care. Provide reliable information and support informed decisions. Together we can improve the lives of those with rheumatoid arthritis.